Hello everybody, it's Dr. Kevin Kurchansky. I am the Director of Physical Rehabilitation at Triad Pain Management located in Tempe, Arizona. This is a video regarding our Halo technique. The Halo technique was a proprietary project that we are kind of still in the process of creating. However, we are performing it on patients currently. The Halo stands for Hip Arthrokinetics for Lumbopelvic Optimization. It's a bunch of words. It basically means we look at the way your hips affect your lumbar spine, and we look at the relationship and the interaction between the two. Low back pain is a condition that is a very expensive condition in the healthcare world. There's not a lot of dead set treatment options for them. There's a lot of things that work for a lot of different people. However, there's really no specific way to isolate which patients are going to be successful with which treatments. And as a result, there is also a lot of wasted money associated with this. And unfortunately, there's time and pain and suffering that goes along with people that suffer from any kind of condition in the hip or low back. Essentially, the way this was designed was that the hip is designed to be a very mobile joint. Your joints aren't necessarily created to be stable or mobile. However, you can read a lot from people in this world who like to discuss what joints are more prone to. And the hip joint actually tends to be more prone to being a mobile joint. And oftentimes what we find with people who have any kind of low back, pelvis, SI, or hip pain is that they lack movement inside of the hip. Immobility, we know, leads to degeneration. There's compression inside of the articular cartilage. That compression leads to an unhealthy environment. That unhealthy environment degrades the tissue. And then someday down the road, you oftentimes see degenerative changes or arthritic changes in the joint on X-ray or whatever diagnostic study you perform. Now, peeling back a little bit from that, what we'd like to see is an element of improving function associated with hip biomechanics. In the people that suffer from low back pain or pelvic pain or hip pain that pass a series of orthopedic testing and functional range of motion testing, what we see is that people who score higher on our testing have better results with the procedure that we perform, and that's the Halo technique. Essentially what it is a way of breaking through a bunch of capsule tissue that surrounds your hip joint, freeing up the joint to be able to move properly. When the joint can move properly, you can then function the way you were designed to function. You can teach the muscles to work the way they're supposed to work, develop some strength, and then as a result of all the muscles doing the jobs that they're supposed to do, as a result of you having the proper range of motion that you're supposed to have, there should be no additional forces going on inside of the spine or pelvis that would lead to pain syndromes. So ideally we remove all of those compressive forces or shearing forces. We create stability in there with the post-op rehab program. And then what we find is that we minimize or resolve those low back, pelvis, and hip issues associated with the patients that come in and the presentations that we see. I'm going to show you here briefly. Dr. Brandow again is going to show you on Alicia how this technique is performed. A lot of our patients that undergo it tell us that they wish they could have seen what was going to happen to them prior, or even in some instances, patients are just curious about what is actually going to go on. Technically, this is a manipulation under anesthesia procedure. However, you'll find that there really is no manipulation that occurs. It is a mobilization of the joint. It is a mobilization of the soft tissues that helps to free up movement inside of that area and then achieve the desired results that we're looking for. On a side note, most of the patients that we see, we are looking at this from an element of pain. We restore function, their pain goes away. We had an interesting instance where we got to work on a patient, an 18-year-old male. He was an athlete training to play football in college. He had very tight hamstrings and very poor hip mobility. Still a stellar athlete with amazing numbers with his vertical leap and his broad jump and a variety of other tests that he was put through. He underwent the Halo technique for 2 days. We do it over a period of time and also to make sure that we minimize any risk of damage or injury because as you'll see it is kind of a relatively gentle procedure because of the way we perform it. Anyway, after about 2 to 3 weeks following his procedure, he went and got retested in his vertical jump and his broad jump and all of the aspects that they were looking for in terms of athletic performance. And what they found was his vertical jump actually improved by, I believe, 4 to 5 inches. His broad jump improved by 7 inches. And he also improved in some of the other numbers that they tested. Obviously, his range of motion was something that he improved in as well. Being a clinician and seeing patients who have improved with this procedure over the course of time is nice, but also being somebody who's involved with function, which is really my area of specialty, this is something that's very exciting for me because what we can see is there's an improvement in function, and it translates into athletic performance as well, just by properly articulating the joint and properly allowing that joint to move freely throughout its natural range of motion. So I know that's an aside from the actual technique, and that's probably not why you're actually watching this video, but hopefully that does help to explain a little bit about the way that this procedure can not only restore function of the joint, but also minimize any additional excessive forces that are going on inside of the area surrounding it. As always, if you have any questions, feel free to contact me at drk@azpain.com. That's drk@azpain.com. Thanks. Have a good day. Here we have Dr. Branda and Alicia, and they are going to demonstrate the halo technique that we use for hip and low back MUA. First, Dr. Branda starts off by taking the hip and driving it into the back of the socket in order to improve the articulation of the joint. Typically, if this is performed on a patient who is awake and has a significant hip immobility, they will experience a lot of pain. You can see him driving it through internal and external rotation, and he is actually pushing straight down into the hip. After we do that and break up the hip capsule, he'll then take the leg into what looks like a hamstring stretch, which is bringing the leg into hip flexion. The doctor or tech on the other side of the table would be working on the hamstring musculature, loosening it up, massaging it, things of that nature. After doing that a few times, he'll then take the hip into full hip flexion with the knee bent. This is designed to get as much hip flexion as possible. You can see Alicia has pretty good range of motion in this area. And even though our patients typically can't go that far, once they're under sedation, it is much easier to get them up that far. And he'll work through all planes of movement while he's up there. The next thing he'll do is put the foot down by the inner thigh and take the leg into adduction. The other physician would be working on the muscles, stabilizing the pelvis, and what typically looks like a butterfly stretch or an adductor groin stretch. After working on that, we'll take the leg to the other side and work on the TFL and the piriformis. It's important to note that there will be another physician on the other side of the table, along with a nursing staff that assists with this. The rotators of the hip get stretched, and that also helps to affect the capsule. The other physician would be stabilizing the hip and pelvis on the other side to make sure that there is no additional movement. After this, he'll take the leg straight out. He'll be at the end of the table, and he'll walk the leg up into adduction. The other physician would be on what would be Alicia's right leg, stabilizing that leg. He'll do it one way with the toe up, and one way with the toe pointed towards the head. That's to improve hamstrings and adductors. After that, the patient would roll onto their side. Of course, you're under sedation, so the nursing staff and the doctors move you from side to side. One doctor would stabilize the pelvis and kind of loop through your legs to stabilize your body, while Dr. Brandau pulls you back into hip extension. This gets the quads, the hip flexors, TFL, and the adductors. And he'll work through all ranges of motion. And then the last part is when he's going to get the two joint muscles, iliopsoas and rectus femoris. He's going to stretch just like so. The last part would be putting the leg down. The practitioner on the other side would then go through and mobilize the lumbar spine. And as you can see, the term manipulation under anesthesia is a little bit overblown. It's much more like a aggressive stretching or mobilization under anesthesia. Depending upon the patient, there are sometimes a few other movements that are added in, but in most instances this is adequate.